9 o'clock. So shall we start? So welcome everyone to our Oceania mental health webinar. So today's theme or title, Wellbeing at Work, Cultures of Support and Connection in the Pacific Region. So before we start, I would like to acknowledge the traditional custodians of owners of the lands across Oceania. We are honored by their wisdom and connection to land, sea, and community. So as we explore workplace mental health, let us draw inspirations from our indigenous peoples' holistic approaches to well-being and incorporate and learn their insights into our modern work environment. So may this acknowledgement remind us of our shared responsibility to create workplaces that honors diversity, promote inclusivity, and support the mental health and well-being of all individuals. My name is Connie Gunn, so a lecturer and researcher in planetary health at Griffith University based in the Gold Coast campus. So as your moderator today, and I thank you so much for joining us and we share this beautiful space for this important conversation. So I work and grow and nurtured on the land of Turrbal and Yugara peoples who are the traditional custodians, and I pay my respect to their elders, past and present, and extend all the respects to Aboriginals and Torres Strait Islanders peoples with us today and also hearing this recording. So these lands have always been places of learning and teaching, research and collaborations for tens and thousands of years before Griffith University. And this webinar is brought to you by the Oceania Mental Health Advisory Committee led by Julie Miller AM. We are a group of working people to improve mental health across the Pacific Islands in Australia. So our goal is simple: to raise awareness, share knowledge, and help our communities to thrive. So we are also part of the World Federation of Mental Health, so a global organization that has been promoting mental health and well-being since 1948. So the World Mental Health Day, October 10, is also a program of the Federation. And every year we celebrate World Mental Health Day on October 10, and in some countries, World Mental Health Month, to raise awareness within the global community about mental health challenges, gaps, and priority through collaborative and unified voices. And in our Oceania region, with its very unique cultural diversity and geographical challenges, we know that mental health in workplace promotion takes on added dimensions. So from cities to islands and different locations, we face both shared and also distinct challenges in supporting mental health at work. So today we have gathered experts across the region to share their insights, research, and practical strategies to promote mental health in various workplace settings. So I'm hoping and I'm very excited their perspective will help us understand this multifaceted approach that is needed to create a healthy work environment in Oceania. So we have first, throughout this webinar, please put in comments, chats, or reflection and thoughts in the chat box. And we have our lovely Dr. Natalie Cutler to monitor the chat, and we'll have a combined panel discussions after the full presentation. So we'll have 4 presentation with one performance piece in between to entertain everyone. So first, I guess we are thrilled to introduce our first speaker, Associate Professor Fiona Charlson. So Associate Professor Charlson is not just any researcher, so she's a trailblazer in the field of mental health and climate change. And she's the founder of the world's first mental health and climate change transdisciplinary research network. So Professor Charlson has dedicated her career to tackle some of the most pressing global mental health challenges. So her work is at the cutting edge, exploring how our changing climate affects our minds and well-being. So this is very fascinating and incredibly relevant to our discussion today about workplace mental health in Oceania. So I'm particularly very excited about this talk on how climate change might be impacting our workplace, and her expertise will offer as valuable strategies for creating resilient workplaces. So without further ado, please join me in giving a warm welcome to Associate Professor Fiona Charlson. Thank you.
Thank you, Connie. I'll just get my slides up here. And just confirm that everyone can see the correct screen. Yeah, great. Thanks, Connie, and all the organisers for today for inviting me to talk about this topic, which is a topic that is becoming, well, I guess it's emerging in people's awareness as, you know, our region in particular is really feeling the extreme, the climate crisis in full swing at the moment. So yeah, I've been asked to talk about the mental health implications of climate change for our workforces. But I'm also aware that this is kind of a new topic potentially for quite a few people. So I just thought I'd start with a little bit of an overview to set the context about what we know about this intersection of mental health and climate change. And then I'll go into what we know about more specifically, you know, the implications for the workforce. So just briefly, we know it's pretty well established now that climate change related events are associated with a really wide spectrum of mental health and wellbeing outcomes. And but despite knowing that from the literature, compared with other health areas, social emotional wellbeing or mental health and wellbeing and climate change is really under researched, and particularly in the context of rural and regional communities, and particularly in you know, many of the small island countries in the Pacific that a lot of you are joining us from today. So we have a long way to go in terms of research. This was a conceptual framework. It's more of a hypothetical model or visual of how mental health and climate change are linked, and it's really complex. And I want to just sort of let this sit for a little minute, because it's really important in terms of understanding the rest of the presentation that I'm going to talk about today. So you can see there that there's the risk of mental health and wellbeing, risks to mental health and wellbeing, I should say, in the centre there. But it's not just these sort of direct impacts that we might be thinking about. It's really complex, and it goes across many, many sectors. And there's lots of crossover in terms of these pathways. So you can see there are things mentioned, such as interruptions to public transport, physical injury, costs, pressures on health systems, which is hugely relevant to today, pressure on frontline responders, I will talk about, reduced social cohesion, lots of things mentioned there that all sort of have these complex pathways that make their way into impacting the mental health of individuals and populations. So which of the climate hazards do we know to be have impacts on mental health? And we can kind of classify them, I guess, in some kind of hierarchy as those direct impacts, which are heat, rainfall and humidity, fires, floods and storms, have a very direct impact on mental health. And then we have these kind of more secondary or slow creeping climate hazards, including drought, sea level rise, land degradation, air pollution, physical health, and water and food security. And then we've got those real society-wide impacts of climate change that was sort of referred to in that previous visual, including displacement and migration and that loss of connection to land that's so important, health system pressures, reduced economic productivity and reduced economic incomes, agricultural losses, strain on community cohesion and social capital is a really important one, loss of nature spaces and that connection to nature that's important for mental health, and also conflict and political instability. In terms of what types of mental health outcomes are affected, there's a lot of research sort of assessing psychological distress, which you could consider as sort of maybe even a normal response, and a subclinical condition, but can certainly go on to more serious mental health outcomes. Then we've got clinical disorders, at least according to the Western disease classification systems, such as trauma-related disorders, depression, anxiety, and even elevated rates of self-harm and suicide. Exacerbation of pre-existing illness, particularly in the case of extreme temperatures. There is research showing that there are increased rates of psychiatric-related hospitalizations and deaths. These environmental and climate-specific constructs are quite well highlighted in the literature. I think most people have heard about climate anxiety in the media, etc. And also something that's underexplored is the potential neurodevelopmental impacts on unborn and young children. So with that sort of scene setting, what do we know about the impacts of climate change and on the mental health of individuals in the workforce, and particular occupational groups? And it is well established that there are several ways in which the lives and mental health of various occupational groups can be impacted by climate change. And those who respond to extreme events or whose organisations are affected by extreme events may experience traumatic exposure to death, injury, destruction, fear for one's own life, illness or injury, or knowing people who were injured, major changes to job roles in order to respond to the crisis, loss of homes, loss of employment, negative media coverage or response from the public relating to their work responding to the crisis, disruption to infrastructure, transport and medical care. These are all sort of really kind of direct and acute and really critical ways in which our workforces are being impacted by those kind of extreme weather events that we're seeing more frequently and more intensely. So, people who are in these organisations who are, are there who to, I guess, deliver frontline services are also being impacted on a personal and a professional level. And the more gradual, prolonged effects of climate change can also directly affect employees' lives, for example, causing them to lose significant work hours due to extreme temperatures, which can lead to severe economic consequences for those affected. And these impacts on personal and professional lives can be really profound, and they can have far-reaching and long-lasting effects on mental health. So what do we know about workplace behaviours, how this might play out in the workplace? And a scoping review was done a couple of years ago now, and it found that poor mental health can negatively affect workplace behaviours, including productivity, absenteeism, presenteeism, and turnover intentions. It also noted that there's very little literature on this. They only found 5 studies, but the available data did suggest that the psychological impact of extreme events could lead to increased job tension, higher turnover, and workplace hostility. Stress about extreme weather could also impede the ability to make essential work-related decisions. And for those who work in the environmental sector, concerns about climate could lead to overcommitment to work. And that is something that has been shown both in the literature and anecdotally. And also something that I have observed, you know, people who are really on the front line of climate, working in the climate change sector and the environmental sector, really kind of taking a personal and professional toll in this space. So this paper, this scoping review, outlined a few implications for practice and policy. It firstly noted, you know, due to only 5 papers being found, that there's an urgent need for research for us to further understand this. But it did also note that the available evidence suggests that workplaces should prepare to mitigate potential negative impacts on mental health and consequently on functioning by ensuring high levels of social support at work. And hopefully with further research, we can understand this more and find strategies that go even beyond that quite obvious social support that they've recommended. They also say that organisations and their workers can benefit from adequate training to cope with extreme events, support from managers, support from colleagues, and education regarding effective coping strategies. So what about, you know, I've mentioned a few, you know, sort of types of workforces, but what other workforces do we know that or have been highlighted as potentially the most impacted? And it's just to remind you that this is not an exhaustive list, because the research in this space is very early, it's very emerging and nascent. But that should say farmers, not famers. But farmers and fisher people have been identified as heavily impacted by the in terms of mental health due to climate change. I mentioned environmental workers, emergency responders and other frontline workers that are front on with, you know, disaster response, emergency response. People working in education or teachers are impacted. People working outdoor, for example, in the construction industry. You know, we're particularly thinking about heat there, elevated temperatures. Human and social services, who are the people who are really you know, that's the sector that is largely involved in responding and providing those safety nets and services that people need in response to climate change. And of course, our health workers. And I'll just talk about that for a little bit in particular in terms of the mental health sector. So there's research showing, I mentioned earlier, that emergency visits, hospitalisations are significantly high during hot periods. Extreme weather events cause more consultations. Suicide goes up, substance use goes up. In fact, all psychiatric related disorders are impacted and placing a higher demand on mental health services. So we really need to plan for this predictable disruption to health services due to climate change. So this is just a couple of slides from a paper talking about the clinical implications of climate change for mental health. I'm aware that not everyone is working in mental health services here, but for those who are, Tara Crandon and colleagues has proposed this approach of the role of health professionals that can be done at the individual, the community level, and also a role in advocacy and education, which can be really impactful in terms of what health professionals can provide to individuals and communities. Crandon's also proposed the SAFE mental health assessment, which are these are the key elements of clinical mental health assessment in the context of climate change, starting in the setting. You can, in the waiting area or entrance, there can be cues of safety to share climate concerns. Awareness is that the clinician is aware of and has sufficient support for their response to climate change. F is for facts, clinician knowledge of mental health impacts of climate change and identifying need for clinical intervention. And engagement, which is to engage clients or patients through validation, connection to others, and values-based action. And whilst this was particularly written for the mental health workforce, there are, parallels for other people working in other sectors that can be taken from this. I'm just going to finish by just highlighting this one slide, just as a sort of food for thought, which was a paper published recently, a discussion paper, which sort of challenged the problem with recovery in the face of climate change. So historically, the goal for mental health in response to cyclones, fires, what have you, has been to sort of swoop in after an event and really focus on often a short-term funded approach to returning people to their pre-disaster level of mental wellness. But we've sort of wrote this paper to sort of challenge maybe our thinking, because that recovery goal, whilst very noble and perhaps it's been appropriate in the past, is just a little bit problematic moving forward, because it assumes that these extreme weather events are single events. And it assumes that extreme weather events are unexpected events or sort of irregular, unpredictable events. But now they're becoming much more frequent, and we know that one is not far around the corner. And that we also think there's a problem with this concept of recovery is time limited with a clear endpoint. And with these compounding events, people, if there is a time limited recovery period, people don't have the luxury of that anymore before another sort of event or challenge from climate change comes their way. So with the current assumption of recovery as circular, in which the goal to return to the starting point, we sort of feel that has the potential to set people up to fail. And as an alternative view, is that not being able to return to life as we know it is not a failing, but a recognition that this return is not feasible and may not be appropriate. So what we were sort of advocating is that orientation towards the positive outcomes of ongoing adaptation to sustain mental health and wellbeing may present a more constructive approach to collectively supporting communities' mental health in response to our changing reality. So I guess a shift from recovery perhaps to building climate resilience and working with people quite early on. I'm going to leave it there. Thank you. That's the QR code if anyone would like to take a photo of that links you to our Research Network's website. Thanks.
Thank you, Fiona. Maybe we'll just put a couple of minutes for the slides for people to take a picture. Really,
oh, sorry, I'll go back.
It's okay. Sorry. Really, thank you for your invitation to, for us to challenge some of the conventional ideas about recovery in the context of climate change and mental health. I guess instead of just trying to go back to how things were before, I think we should also consider perspective of advocating for ongoing of adapting and growing, which is in our ever-changing world will be much more realistic. And thanks for really the insights for our professionals working in the climate vulnerable regions. And I see some of the comments coming in as very resonating, the points you speak about. So we move to our next speaker, and I'm thrilled to introduce Dr. Balram Pandit. Dr. Pandit is bringing us a wealth of experience to our discussion today, serving as the medical superintendent at St. Giles Hospital and advisor on mental health to the Fijian government. So his expertise as a consultant psychiatrist and associate professor of psychiatry at the University of Fiji is his passion for mental health education is evident in his work at Fiji National University, where he developed the met a psychiatry program, and his affiliation with numerous professional bodies really speak about his global perspective on mental health issue. But I find very particular exciting because Dr. Pandit's work in his focus on systemic change for sustainable mental health care. And he's not just thinking about individual treatment, but how we create lasting improvement in mental health care across our region. And on the personal note, I love he's also a yoga practitioner and also a poet. So it just goes to show that mental health professional practice what they preach when it comes to holistic well-being. So without further ado, please join me in welcoming Dr. Balram Pandit, who will be speaking to us about strengthening well-being at workplace. Dr. Pandit, the floor is yours. I believe you could have a magic button to share your screen, but I have your slide as well if you would like me to control from my end.
Okay. Can you share slides from your end?
Sure. I can hear you.
But we can't see the slide just yet.
Not yet.
No. Okay.
Would you like me to share from my end?
Okay.
Is it fit? Yep.
Yes. So thank you. Thank you for your kind words. So and the topic has already been mentioned. So can we go to next slide, please? Okay. So we'll walk through this presentation in the following heading. So a little bit about introduction. We'll talk briefly about the concept well-being, and then we'll look at the WHO model. And we are trying to develop Fiji's national guideline on wellness at workplace. So we'll have a glimpse of that. Then we'll look briefly at factors influencing well-being, and then interventions, followed by how a psychological workplace should look like. And then we'll look a little bit at Fiji challenges and way forward, and then we'll summarize it. Thank you. Next. Okay. So when we talk about well-being, we are all aware well-being at workplace. We are all aware about the burnout at workplace, and especially as manager, when we see the burnout in staff, the difficulty in retaining staff because of their resignation, because of dissatisfaction at the workplace, and how it contributes to the low productivity of the organization. So when we look at all these factors, it's natural to think about intervention, and that intervention would be well-being. And well-being at workplace, like how to keep our staff well motivated and good in health to contribute towards a better productivity of the organization. So it's really crucial for sustainability of the organization and for sustainability of the individual as well within the organization. There are researches which shows that when well-being programs are well thought, properly implemented, it really works. And well-planned well-being programs are effective. And when it is implemented, then there is a natural increased employee retention. We can see fruits in form of increased employee retention, high productivity, and psychological well-being. That means satisfaction in the workers as well. Thank you. Can we go to next slide, please? Okay. So looking at definition of well-being, so, and I think it's worth mentioning first about well-being and understanding a little bit about well-being and wellness as well, as many of us may not be here in the mental health sector. So when we talk about wellness, generally our mind go towards physical dimensions, doing exercise, yoga, and we do think sometime about the meditation. So a little bit of mental health issues as well. However, the well-being term is more broader compared to wellness, and it encompasses not only physical, mental, social and spiritual health of the staff, but it also encompasses the job satisfaction, whether the person feels, find the job stimulating or not, whether there is sense of belongingness, whether that person has, sense of fulfillment about the job. So well-being can also be looked at from a term from the workers' side, while wellness appears more from organization side. So that's why when we talk about happiness index, it comes to it falls generally within the well-being concept. So all I want to highlight here is well-being would be better terminology. And when you look at the statement from International Labour Organization also, it encompasses all these things. So it talks on top of the health issues, it talks about the safety of the physical environment, the how can we create and conducive environment, the climate at workplace. And so ultimately, the organizations should ensure that the workers are safe, healthy, satisfied, and engaged at work. So it's very broad, and it's really encompasses things way beyond the general concept of health that we have in our mind. Next. Okay. So now looking briefly at WHO's a healthy workplace model. So we have looked at well-being, and we also discussed about well-being at workplace. So in the same line, if you look at WHO's model, it encompasses also the physical work environment, their psychological work environment, the personal health resources, and it talks about involvement of corporate and community involvement. So as to contribute towards overall productivity of the organization through the through making our staff feel well about the job, feel in terms of good health as well. And hence it aims at comprehensively addressing issues which are more work-related physical and psychological risks. It also promotes talks about promotion and support of health behavior. And broadly, it mentions about social and environmental determinants. So it should also remind us about the term that we often hear at the working environment, especially in corporate sector, that keep your personal life and professional life separate. However, it's difficult to do so because the same person is working at home and he is coming to workplace as well. So it's not that easy. So it's good that indirectly, if you can see, the WHO has looked at it and tried to address that as well, advises to address that. Next slide, please. So now, what things can make our model a successful model, that well-being model, a successful model in case we intend to implement it, and all the organizations are required to implement it anyway. So there should be leadership commitment and engagement. Leaders should not only be committed to develop these models, but also they should engage in such activity. They should lead by example, and they should involve their workers as well, and a representative of the workers while developing these programs, because when implementation comes, obviously they should feel happy about it as well, provided they have been involved in the beginning. And it should, while developing, we should make sure that the no business ethics and legal issues or business ethics and legal issues are taken care of. So we work within the boundary, and so that later on there is no problem when we start indulging in such activities. to create well-being in our staff. And it should be systemic, thorough, and a comprehensive process should be followed so that there can be an effective implementation. It can lead to continuous improvement. And for ensuring its sustainability and integration, of course, we should think about the funding, the resources that we have, the existing program, and how it can be integrated to the existing program, and whether we will be able to sustain it in long run, whether we will be able to keep funding about it, keep having those resources, whether we will be able to continue. And equally, there should be effort towards the monitoring and evaluation of these programs as well, because many times we start, but in the midway somewhere, we forget about it. And it has to be bi-directional, as I have mentioned. Even if you have a good program at your workplace, and if the staff are not volunteering, then it can be a challenging thing. So in this context, I would also like to highlight that, self-care is not about being selfish. Because if you can take care of yourself, then you can contribute towards your family, you can contribute towards your organization as well. So you can see a photo there with a yoga session at St. Giles Hospital. So yoga session, and being head of the institution, I am participating in the yoga session as well. And next, sorry. So this national guideline on workplace mental health, workplace mental wellness is a draft one. Obviously, this will go through changes, but I would briefly like to highlight the objectives currently. However, even these objectives will need to be modified later on. It needs further brainstorming. So it talks very clearly about the mental health condition to support staff, about work-related mental health condition. If someone has already pre-existing mental health condition also, how can we address it? And how can we help that staff? And to promote mental health well-being, and how can we help staff in maximizing their work? So overall, preparing favorable and productive, creating a favorable and productive environment at workplace. Next slide, please. So this photo shows staff playing volleyball at our workplace. And the key steps for establishing such establishing such program at our workplace. 6 points have been mentioned currently. So this is about, as we were talking about, leadership support and commitment. And then workplace mental wellness committees, which we have, workplace mental wellness policies, we are working on that, and costed work plan and mobilizing resources. So obviously, when we want to implement any good wellness program, that has to be funded. So there has to be a planning towards costing towards it and mobilizing resources. And not only that, there has to be, it needs to be operationalized further, and then monitoring and evaluation as well. So this is brief excerpts from our wellness program guideline that we are trying to develop. Next slide, please. Okay, we look briefly at the factors that contribute to towards or that influences workplace well-being. These factors can be directly related to work, or there can be indirect factor affecting work. And direct factors can be organizational climate. When you say organizational climate, it can be a whole lot of things. There can be issues related to infrastructure, and these days IT resources and IT training, and the kind of feedback that we provide to our staff is supervisor and subordinate relationship. Then there can be issues like career concerns. So if there are enough opportunities for career advancement, or promotion, or some kind of other increments, And then I have already mentioned about quality of leader-subordinate interaction, and then occupational demands. So many times the workload, affects the motivation of the staff as well. If the workload is too high or too low, both are not, motivating for the staff, because if you sit idle also for so long, obviously you feel a kind of boredom. And if it is, highly demanding and you are less staff, there are not enough staff, then obviously it can lead to burnout. So that is also counterproductive. And I was talking about technological challenges. Technological challenges are not only associated with the availability of the resources, but also in terms of training, and especially during change. One problem with the technology is the softwares keep on having, their versions keep on changing, and you have to keep yourself updated with the newer versions, because if the organization acquires that version of the software, you have to be ready to use that version. So similarly, the training needs to be provided. And staff safety, especially in mental health sector. Mental health sector in general is associated among all health sectors. If you look at mental health sector, is actually associated with higher risks. And accordingly, the safety of the staff need to be ensured by the employer. And also there should be some sort of support. The support can be in form of financial, so we call it risk allowance. We are still struggling in Fiji to ensure that risk allowance, which our Mental Health Act also supports, but it is yet to be realized. So then coming to the factors which are indirectly related, so the facilities at workplace, and then life changes in the person's life, how that person is, whether the person is able to cope well with the changes in life or not. The family responsibilities, as I was saying, you cannot separate, the family, the factors in that person's life entirely from the factors at workplace, because it's the same person going here and then managing both the sides. So those factors are naturally likely to influence the productivity of the staff. So organizations should also think, how can we be a bit more flexible? How can we support? One of the example can be, say, family care leave. There are many organizations which do not have family care leave among the list of their leave. So staff are many times bound to take other kind of leave to support their family in time of need. And then if your staff is in relation, having some issues related to relationships or conflicts, that can influence personality factors of the staff, and physical or mental health of the staff can also affect the overall productivity. Cultural factors are equally important. There are many times when we have seen staff, despite of going through a lot of stresses, they obviously keep on pushing themselves. So instead of taking a break, or brief break, say, they keep on pushing themselves till they really fall prey to the stress and develop some sort of mental health issues, or maybe physical health issues. Because the cultural factors, force them to not to yield in face of such adverse circumstances, to keep on pushing, because probably they will be interpreted as a weak person. So this is one of the several factors. So that cultural factors are equally important, and as a manager, one should be mindful of any pertinent cultural factors as well. Next.
I'm sorry, Dr. Lauren. So one last minute. Thank you.
Okay. So looking at interventions can be at primary, secondary, and tertiary level. So at primary level, we can look at whether their environment needs to be redesigned, and then provision of any nap time or One important thing that I would like to highlight from this slide is to keep the job characteristic smart. That is, the job should be stimulating. Staff should have mastery. For that, the staff should get feedback and training, and they should feel, there should be a sense of agency that will make a person to have some sort of control over the timing and the important decisions that are made there, and then relational issues and the tolerability, basically tolerability from the, so that gives basically flexibility. Like there should be moderate uh, 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 like in terms of deadlines and time, there should be some consideration from staff as well. So a little bit of flexibility basically. So next slide, please. So in terms of secondary intervention, it mainly focuses on improving the ability of the staff to cope the stresses and detect stress, training and education. One of the example would be like here we have developed some programs. We send staff for overseas training as well. Then career advancement opportunity, train some staff for CBT or some other sort of training so that they can utilize like self-cognitive statements as well to help themselves. And other resources should be available at the hospital as well to help them. Routine health surveillance should be done by staff. Next slide, please. And tertiary intervention would be like providing medical care and employee assistance program. Return to workplace plan should be there. And then also if we can be a little bit more compassionate, then we can think of providing job opportunity to the family members of the worker in case of death of that staff. Because if you want to retain staff, there has to be a comprehensive look. Next slide, please. So in an ideally a workplace should be a workplace with psychological well-being should look like this. A proper well-being at workplace, the model should look like this. So there are contributing factors, and then you see three outputs there. Output goes to three areas, like there can be individual outcomes for the staff, then organizational level outcomes, and then there can be societal level outcomes as well. Next slide, please. Yeah. So Fiji challenges, briefly we have discussed about our infrastructure issues, IT issues that we have. There is a huge problem with the human resources. We have financial constraints, and there we have limited treatment options. And we are still working on some of the policies, contextual policies I'm talking about. And then if we can look at, I have already mentioned about risk allowance, and staff insurance is currently, staff are supposed to do their insurance themselves if they want to, otherwise. So that needs to be looked at. Way forward is improvement in terms of infrastructure. We are trying to develop St. Giles Hospital into Regional Institute of Mental Health Care and Research, that is RIMCare. We are trying to develop community-based mind farm, meaning which will have the supporting structures basically there in form of halfway home, rehabilitation center for chronic mental illnesses, as well as substance abuse, and something what we call Center for Worried Well. And there will be a huge workshop there to train themselves to make their life more productive. And then strengthening with a organization with the human resources. And as we move towards digitalization and telepsychiatry, strengthening it with the required resources, and to continue strengthening working environment and opportunities for wellness activities and peer support in case of need. Next slide, please. We are almost there. So last slide. So we now know that staff well-being is not only, it doesn't include only physical, mental, social, and spiritual and economic health of our staff, but it includes the work satisfaction, sense of belongingness, and sense of fulfillment. Effective implementation of the well-being program shows better productivity and growth of organization. And we need to have dedicated budget with clear and compassionate policies if we want to implement these programs effectively. And it's not surprising to see people moving towards the healthiest workplace. When I say healthiest workplace, it includes, it's obviously, I mean, as we have discussed. So in future also, these healthiest workplace will be destinations, and it will be hard to retain staff if we do not improve our organization in terms of well-being. Hence, promoting well-being is beneficial for both staff and organization. Thank you. Next slide, I think. Yeah, thank you.
Thank you so much, Dr. Pandit. Please keep your comments, reflections, and questions coming, and we have a combined panel Q&A after all the presentation. And I really like self-care is not selfish, so we should do a hashtag for that, right? So self-care is not selfish. And our next presenters, our speakers, Bridget Ryan and Eleanor Seru, so who'll be presenting the fascinating study on workplace burnout in the Pacific Islands medical workforce post-COVID-19. So Bridget Ryan is a program manager with a public health background, currently working at St. Vincent's Hospital in Melbourne. Bridget's work with the Mental Health International Unit, particularly her coordination of the postgraduate overseas specialist training program, has been instrumental in building capacity and fostering international collaborations in community mental health. So, and here's something exciting. Bridget is also involved in the Project Echoes Network, so which are creating interactive communities of mental health care practice here in the Pacific. And joining Bridget is Eleanor Seru, a health psychology with over 2 decades of teaching experience at Fiji National University. So Eleanor has a bachelor in applied psychology, and she's also currently pursuing a PhD at the University of Adelaide. So her passion for research in mental health, alcohol use, and substance abuse among the Fijian population brings a crucial local perspective to our discussion. So Eleanor's expertise in psychological assessment and data analysis will undoubtedly provide us some very valuable insights into mental health landscape for our region. So please join me in giving a warm welcome to Bridget and Eleanor, and we're all looking forward to hearing all your groundbreaking study on workplace burnout in our Pacific medical workforce. The floor is yours. And I can see screen and slides now. Thank you.
Yeah, thank you so much, Dr. Connie. Really appreciate that warm welcome. And it's a good topic to follow after Professor Balaram's important framework as well. I'd like to start the session today by letting you know that I'm coming to you from the land of the Wurundjeri Woiwurrung people here in Naarm or Melbourne, and I'd like to pay my respects to Aboriginal and First Nations people in this nation, and any First Nations people in the room, acknowledging the ongoing harms of colonisation to the lands that we're in, to the health of the people, and to the mental health particularly. Our topic today is, do you regularly feel stressed by your work? And I think, following on from Dr. Balaram's discussions, I think it's quite clear it is a hot topic at the moment. Let's see if I can change the slides. So we are presenting very early results of this study. So we studied workplace burnout in the Pacific Island medical workforce post-COVID. Representing Eleanor and I are really proud to be representing this team with the primary investigator, Dr. Adil Chang. We have investigators from the Fiji National University and from St. Vincent's, and also support from the Pacific community. So when we're looking at research, my first discussion of this, my manager said, you know, burnout, I don't think it's a thing. And it kind of stopped me in my tracks. I'm saying, well, what do we think about burnout? And he went on to explain what he thought was happening. And so I wanted to share with you, you know, thinking through Dr. Balaram's presentation as well, what is it that we think about burnout? And this parable really stood out to me in that if you're just looking at one aspect of it, you may have, oh, look, it's like a rope, or, oh, look, it's strong like the trunk of a tree. And I wanted to kind of share with you that instead of seeing it as the theories or the explanatory ideas, instead of seeing them as antagonistic and you're wrong and this is not happening, is seeing how they're complementary and provide that global view. So our challenge for today is to be very brief in this brand new research, and to give a bit of an overview of what was shared for us. And what we want to do is, what did we look for? What did we find? So we did want to have a think about that definition and theory. We are sharing with you some key results with Dr. to be Eleanor on the line today. We thought we might really focus on some of the qualitative work. So we wanted to focus on that focus group discussions and the key informants. But we wanted to share with you what that might mean for you. So we did talk to people from all over the Pacific. So Fiji was probably our strongest network, but we did manage to talk to people throughout a lot of different places. What did we ask? We asked them, did you feel stressed by your work? And surprise, surprise, people said, yes, they do feel stressed, as I imagine you do as well. So the WHO International Classification of Diseases looks at burnout as an occupation phenomena, and it's characterized by 3 dimensions. So feelings of energy depletion or exhaustion, increased distance from your job, feeling negative or cynical about your job, and really importantly for health workers is that you are reducing your professional efficacy when you have that chronic stress that has not been successfully managed into symptoms of burnout. So they wanted to say that it's relating specifically to the phenomena in the occupational context, and try not to apply it as a health understanding to other experiences in other areas of life where we know we've all been fed up or had enough. But burnout is definitely a hot topic at the moment. We asked people using the Oldenburg Burnout Inventory, which is a psychometrically robust instrument. So Maslach Burnout Inventory is a gold standard. It's been used a lot. And the Oldenburg Burnout is just slightly changed, and we were advised to try this one. So we did. And we found throughout the range of people that we asked, we were looking for, are there any patterns we can find? But with our results of the 268 people who completed this inventory, we found that 42% experienced medium experiences of burnout, and 55% had high scores. So these numbers were so high that we couldn't really even find any patterns because it was just consistent. People are feeling disengaged and exhausted. It's no real surprise given the experiences we had during COVID, and also that there are factors related to Pacific health. We also had a similar sort of query that I got from my manager is, how can this questionnaire really identify burnout amongst Pacific doctors? These questions are not specific to burnout. If someone is disorganized, they may experience all those symptoms. They may be a non-hard worker, someone who's having an affair, someone who's stressed. Look, this is just an observation, but thank you for being interested. So given that that was what we found, we now have a look at why does it matter for burnout to be there. We know in the Pacific there are several things that have happened post-COVID, and one of them was a massive movement of healthcare professionals leaving to other countries or really finding it difficult to stay in the profession. We see more movement abroad, or more clinical blunders, more people being very disillusioned by the work that they're doing. Burnout has been associated with increased risks of coronary heart disease. We know that it has also been shown to have increased risk of injuries, absence, presenteeism, musculoskeletal pain, temporal pain, shoulder pain from working too hard, depressive, all these things are very common for us. We know it's important in healthcare settings that the symptoms of burnout relate to our capacity to work with clients, to interact and to build that rapport and to understand what's going on. And for Pacific Health settings, we know that there are huge differences in our workload and resource availability and training. And so we're looking to think, what is it that's happening here? And if these large variations in the working environment are causing some aspects. It's important that the definitions and the prevalence finding are helping us to study it as a syndrome, to think through that global picture, and help professionals and institutions to identify and provide proper tools and information that can be used to prevent, assess burnout, and to increase work engagement, so to really tailor what we need. We asked people what you normally do to prevent or manage burnout, and I think people were very clear. They like to spend time with families. They like to debrief. There were very important cultural learnings for this, is that people generally like to do things together. They like to debrief and be around each other. At times, however, they do need a proper space to sit and rest and think. So spiritual encouragement was often mentioned as well in this area. So, you know, feeling that their spiritual their spiritual health was important to consider during de-stressing from the pressures of work. I will now hand you over to my colleague. Eleanor, would you like me to stop sharing?
Yes, Bridget, I will share from my end.
Thank you.
Okay. Hello, everyone. Thank you, Bridget and Connie, for this opportunity. And before I begin my presentation, I would like to pay my respect, both past and present, of the Ghana people. I acknowledge and respect the Ghana people's culture, spiritual, physical, and emotional connection with their land, waters, and community, and on which the land I'm presenting from. So today, as alluded to by my colleague Bridget, I will present the focus group discussions finding for the research that was led by SPC and FNU. And I imagine that everyone in this webinar room would have an explanatory theory of burnout, or you would have been faced with burnout in the workforce in general, or health care workforce in particular. So when we were designing our questionnaires, Bridget has covered the quantitative aspect. The qualitative, or the focus group discussions, focused on 4 key questions, of which Bridget has explained the various definitions and what were the interventions, current interventions. And for my presentation today, I will just focus on the enablers, because we did ask them questions of if they could think of enablers and barriers for medical doctors to access strength prevention interventions. And I must mention that in our focus group discussion, stress and burnout was sort of kind of interconnected or interrelated, the use of the word. And so we found there was a lot of very good to scan access for intervention purposes. First one, or the first point, is just talking about things and can bring up ideas. And one of the responses from the one of the participants stated that, so I think it would be good for departments to sit together and have a plan, brainstorm things that would suit their particular section or their colleagues, and such times have services available for the unit. So we found that communication was an important theme that came out of when we asked that question. Open lines of communication, communicating with each other, top down, bottom up. So it enabled them to sort of share their experiences, particularly with the burnout experience that they're going through. Secondly, ideas for future using of past experiences to improve our next attempts to get through difficult times. And this was specific to COVID. You must understand that we are asking questions post-COVID. So it was really important. What they shared was just, a great way to de-stress. One of the comments, it was a great way to sort of de-stress, because you have someone there in the facility that sort of understands what you're going through, because you're both going through it at the same time. So just the fact that you can, share your experience with someone that was like an enabler. You're not bottling things up. You're able to share it with colleagues who were going through similar things during the time. Okay. What's the next slide? Okay. Oh, I'm going back. The third enabler was finding a space to address concerns. And it's an issue of trust, having to trust or talk to someone you can trust, where you trust in others. So safe spaces was identified, as you would have seen in the previous slides that Bridget shared. More of what they, the choices that they made was more communal rather than individual. Just spending time with family or spending time with colleagues, and having that safe space was something that really stood out. Or being involved in sporting activities, the togetherness, team bonding. So one of the comments that came was one of the most important things for us was to have a small devotion every morning, and encouraging us to be with each other as much as possible. Having lunch and all those things. These are small things, but they do mean a lot, and it carries a lot of weight when it comes to having to distress or to prevent burnout. So the last, just to continue with that. So if you got a chance, you could try and do some sort of social activity, which would benefit the whole team. Even just like sitting movie during an OEC shift or just playing some volleyball. So the space or the togetherness really brought out a lot of difference, and it also built trust in others or even among themselves. Because if you share a load that we are experiencing, most of them eventually feel better after sharing. The fourth enabler was regular offerings and tailoring. Offers of support or supports works well. Spiritual encouragement is something that stood out and came out of the focus group discussion, especially when you're at the lowest point during the situation. This is referring to COVID-19 period. So having certain things that would probably, encourage you, motivate you, especially when you're burnt out and you just don't feel like moving on during the day. So those were the four enablers. And then because we asked about barriers, there was more barriers than enablers. So barriers for the medical doctors to access stress prevention interventions. First one that they identified was the discouragement to speak out or to discuss their experiences. Discouragement in our profession to seek help or openly discussing their experiences. There was a long quote that came from one of our respondents. You can read it in your own time, and this is regarding the differences in the way they are treated. For example, being a Pacific Islander or Itauke, it's very difficult to get encouragement from your senior colleagues. I'll just read the bottom half. I work a lot with visiting specialists from overseas. This is from the respondent or one of the participants. I've worked a lot with researchers, and I feel a sense of belonging. They listen to our opinion, but I don't know why it is very hard amongst us Fijians ourselves to have the kind of conversation, because it feels like there's a lot of topics that are not talked about, and you are not to talk about, and you have to deal with your own emotions in your own way, not to bring it to the department and say, okay, this is what an impact, or this may have an impact on how they are performing. There is no such discussion. So this was one of the barrier that was identified from our participants. Secondly, the lack of recognition, remuneration, and reward. The triple R, recognition, remuneration, and reward, directly contributing to the experience of burnout. And as alluded to by Dr. Balram, people are leaving Fiji and probably the other Pacific Island countries because of the lack of recognition, remuneration, and reward. One of the comments that came from the participant was, so that was one very harrowing experience. And then, of course, there is no remuneration. There is no commendation apart from just a brief tap on the back. So in my opinion, all these things contributed to burnout for most, not only for me, but for most of the other staffs as well. The majority of whom who have resigned from the ministry, as I've mentioned, sought greener pasture elsewhere, and it's usually to Australia and New Zealand. Third barrier was the administration priorities overriding safe space. So what the participants thought that it was important for them to work in a safe space, a space where they could feel safe, a space where, because they spend majority of their time working in healthcare facilities. So when they work in a very poor space, burnout is very, the onset of burnout tend to be quick. And most of the, one of the major contributing factors, this is from one of the participants, to burnout among medical professionals is not just the work and the nature of the work itself, but also the amount of bureaucracy in the system. Like the authority that we have to report to, it's really, it's a very poor system. So that's the administration overriding their safe space as one of as well. Number 4, physicality of the work creates difficulties in practice of safe care. I think it's because of it's sort of linked to the safe space as well. Health equity, professional well-being, not strongly or consistently supported by management. So the comment that came from the participant, if you just don't have time and you have to work all the time, then you can't have a sporting activity or go to family functions or visit families. So just the physicality of work itself creates difficulties for them to have their own time or me times, they would say. Number 5, health equity, the injustices contributing to exhaustion and disengagement. The comment that's there, because I think most times we put up this shield, because we're health professionals, we're supposed to be upfront and we should be okay. If the doctor snaps, then everybody in that facility goes down as well. So that was the response that came, was that that was a bit of an injustice that contributed to the onset or feeling burnout as well.
Thank you.
Okay, have 1 minute? All right. Professional well-being strongly and consistently supported. Number 7, barriers to medical doctors to, the last barrier for medical doctors to access stress prevention interventions was leadership in health service. And we found that there was a need for the leadership to be supportive of changes that's needed. And secondly, policies needed to address burnout. It should be noted that right across the Pacific and Fiji, there are no burnout policies in place or something to help them. At least there's some standard operating procedures. When you see symptoms or you have feeling of burnout, you know what to do. These are the certain things or services that's accessible, things that you can go to. So the comments that came from the participants, when you're a doctor, you'll be faced with this. This is how, but I cannot unless it's been introduced in the curriculum in the last 10 years, because I don't recall anything like that when I was training. This is talking about burnout, to sort of prepare you for what's to come in health intervention, what you can do to counter that stress. It's like have all of them, you're thrust out there and you know what to do. So for most of these participants, they said that they were not taught what burnout is during medical school. So when they're out there, when they feel burnout, it's something that is thrust upon them and they're not prepared. So probably, perhaps if we have the policy, that's something that they can always follow or go to. And another comment came that consultants don't do any clinical work and delegate all the admin work to most of us below them. It feels like sometimes we don't get any support from them. So it's not a level playing field. You can see the picture there. There's sitting on one side of the scale. Okay. So what sort of prevention and support do we need? Of course, there's changes needed in the workplace culture, as well as the community, to prevent, manage, and recover a burnout of health professionals, particularly the doctors. Additional resources are urgently needed to prevent burnout. Equity resources contribute to increased burnout and further distress of burnout experiences. So this means that all people and communities, they have existing strengths, experiences, and capabilities, and they also have resources and are capable of learning new skills and solving problems. And we can use existing competencies to identify and address their own concerns. There was this saying, strength all endeavors and the community will benefit. That's a New Wayan proverb. I've mentioned how, communal or communality keeps coming in rather than individual efforts to address burnout. So global studies, the literature tells us that global studies show a wide range of things that we can do. And there's a call for a cultural shift away from blame and stigmatization and towards shared responsibility and empathy, implementing a multiple targeted actions are likely to lead to more benefits. So the benefits would be organizational intervention aimed at work structure, something that probably Dr. Balram alluded to as well. Interventions promoted by the organization and aimed at employees, and individual focused interventions promoted by the individual, individually driven work-focused interventions.
Thank you.
So
apologies, but I think we've put too much into our presentation and we'd love
okay,
to
so
share more with you.
Points.
Our paper will be published and we're hoping to share everything with you. We've given you our research contacts here. Burnout's a thing. There's a value in talking about it, and there are strategies to help. Thank you.
Yes.
Sorry, Eleanor.
Beautiful.
Thanks, Connie, for the extra time.
Thank you, Eleanor. Thank you so much, Bridget. And we look forward for your findings to be published and share with everyone. And thank all the 4 presenters. And we now move into a very different way of advocating for mental health, a performance piece by a finalist of our Pacific Break, so the Pacific biggest music competition. And the winner will be announced today. So we're going to look forward and all the best to the performance. The performance, it's performed by Mark Harmony and Carney Remus. So it described the connection between how coming back home was as profound and transformative as 2 cosmic stars colliding in the vast expanse of the universe. So Carney represents the voice of the islands themselves, as her lyrics delve into the notion that sometimes the universe seemed to conspire to bring 2 souls together. And when they finally meet, so magic is inevitable. So as most islanders coming back home can relate, so it's like the stars themselves are aligning. So please join me and enjoy this performance.
This is paradise. the moonlight shining through, running round with my head in the night sky. I hear your name dancing in the wind, feel your touch on my skin, and all I have is you right there by my side. We can watch the stars collide, oh my darling, me oh my. All I have is you right there by my side. Sunset in your island eyes, I don't wanna say goodbye. This is paradise.
The stars see us dancing beneath the trees. Yeah, we are wide awake, baby, you know. I see your face in the moonlight. 요즘 배로워디 봐.
And all I have is you right there by my side. We can watch the stars collide, oh my darling, me oh my. And all I have is you right there by my side. Sunset in your island eyes, I don't wanna say goodbye. Oh, oh, oh. This is paradise. 애칠하게 꿰 나우리지 꿰자이스 배워디빠 cause we're not in the by my side. We can watch the stars collide, oh my darling, me oh my. And all I have is you right there by my side. Sunset in your island eyes, I don't wanna say goodbye. This is paradise. This is paradise.
I put the link into the chat box for everyone. It's a beautiful
Thank you,
track, and we wish them all the best for the song competition with the finalists being announced today.
Yes, I'm very sorry. It's a very beautiful piece, and it illustrates actually the importance of finding purpose. And we know that workplaces is not just offices, and we have oceans and different farms and so on. So it's a very beautiful piece. I welcome and invite everybody to have a look at that. So I think moving on, we will have our last presentation from Dr. Elizabeth King. So she'll be talking on leadership for mental well-being and productivity. Elizabeth King is a leadership expert specializing in mindful leadership and mental health. So with over 20 years of experience, she has worked across diverse sectors, helping leaders navigate uncertainty and foster cultures of support. So Dr. King's evidence-based approach combines cutting-edge research with practical application, so making her a leading voice in creating resilience and compassionate workplaces. So she holds not one, not two, but 4 degrees, including a PhD in leadership, and has completed an advanced studies in mind-body medicine at Harvard, bringing a very unique depth of knowledge to the intersection of leadership and well-being. Please join us and welcome Dr. Elizabeth King. Thank you so much. We're all ears to hear from your presentation.
Thank you so much, Connie, and thank you everybody for joining us today in this incredibly important topic at a time in the development of our planet, which makes the coming together to address this topic extremely valuable. As we get started, I'm just going to give you a moment to reflect, and I wanted to ask you to think about a question. What is something kind that someone else has done for you recently? So again, that is, what is something kind that someone else has done for you recently? And if you feel moved, I invite you to pop that in the chat. What this question does is it begins to turn our attention to solutions. Solutions such as some of the things we've spoken about already today. Small acts of kindness. Noticing what's good. Observing the intention to improve people's lives. We've heard these types of things being discussed as quite powerful throughout the morning, and I can see in the chat already encouragement, being asked if I was okay, caring for my kids, these small acts that make a massive difference in our sense of well-being. So we're all seeking solutions to these really grand challenges that are addressing our global community. And in relationship to mental health at work, these solutions are becoming really urgent. As uncertainty rises, exacerbated by COVID, already problematic before that, and massively increasing with the introduction of AI, geopolitical unrest, and the sort of things that we've discussed so far today. There is a hand up. Henry, would you like to make a comment? Henry, please come off mute if you'd like to speak. We're welcoming all voices in the room.
We can't, Liz. It's not how the webinar's set up. I'm sorry that all the questions need to go into the chat and to be discussed later. Thank you.
Sorry, the hand's up, that's all. Okay, cool. All right. So we're all seeking solutions. And like just one example is that 25% of the population is currently deemed to be lonely from studies that have come out of the UK. Locally in Australia, we see that there's been a doubling in the claims for mental health injury at work over the last decade, and less than 50% of people ever go back to work. So we're all seeking solutions. And the questions about these solutions that sort of set us up for our conversation today are, what do people actually need to flourish at work and in life? And I know many of you are expert on these areas, but I think it really helps us to ground ourselves in these requirements, because that's what the leadership for improved mental well-being needs to address. How do organisations create such a context, and what should leaders do? So the hypothesis I'm encouraging us to investigate today, and just to consider how you feel about it, is that the way we lead at work holds an extraordinary possibility for positive change in the area of mental health. And further, an invitation to investigate this idea that this solution is based on developing cultures of practical wisdom. These are cultures where we collectively share ethics and moral values that make us feel safe. Cultures that could be described as wise organisations, where partnership exists between the organisation and the employee based on trust, goodwill, cooperation, and the absolute absence of exploitation. My entry into this hypothesis links back to a statement made by the president of the World Federation of Mental Health, which is that mental health is not primarily a medical issue, and that the solutions are not primarily medical. So this takes us to the recognition of the broader context of the work that you've all been speaking about today. The idea that mental health is actually a result of multi-level systemic influences. I've seen this really well described by a colleague of many of us, the beautiful Felicia Hubert, whose legacy in the world is will be met for the rest of our lives and many more to come. She's written it with colleagues an incredible book. I'll just show you, I don't know if you can see. It's called Creating the World We All Want to Live In. And it's an outline of the impact that positive psychology could have on creating a brighter future. And it just reminds us that mental well-being exists in ever expanding, ever widening circles that are bidirectional, going from our individual experience to our interpersonal experience, to our community experience, our society, and our planet. So the way Professor Hubert talks about it is that it's moving from us, from me to we, to the things that we share. And consequently, we can see the way the pervasive impact of the issues you've been discussing today, poverty, war, inequality, climate change, we can see how they also impact not just our mental well-being, but our total well-being. So in this context of mental well-being being a systemic issue and community lying really very much in the centre of our possible interactions that can have both negative and positive effects, we see why workplaces hold an extraordinarily powerful influence on our mental health, because they are in the centre of our community and they're offering systemic, multidimensional ways to impact mental well-being. The really good news is that, well, recently, due to academic progress and the work of people such as yourselves, is that we actually know what organisations need to provide for people to be flourishing. And we know that when organisations provide these types of contexts, that it's profitable and sustainable. So in our time together, I wanted to invite you now to reflect on some of the principles that many of you will know of what is required for a flourishing workplace. And then I'll introduce to you some principles you may not be as familiar with, which is the principles of wisdom in organisations. And then we can spend some time just reflecting on how these principles may apply in our own contexts and potentially what we could do to enhance leadership for mental health. So, Julie, I'll ask you to just pop up into the chat the snapshot of lists. So as we track our content, I was going to invite you to write some words in lists, or otherwise just grab something to write on, and you could record some numbers down on one side of it. Let's start with 1 to 5. Many people have discussed the requirements for human flourishing in the work context and outside of that by using a very well-known theory called self-determination theory, which suggests that humans have these basic needs for flourishing. Originally brought to us by Ryan and DC Wibo-Kuhl and his colleagues in Europe, did a whole lot of work of applying these principles. And our the friend that I mentioned earlier, Professor Felicia Hubert and colleagues, published this book, Creating the World We Want to Live In, which also outlined the same principles. And what they are sharing with us is that for people to flourish at work, we need to feel connected. So that's the first point next to 1. For people to flourish at work, they need a sense of autonomy. And for people to flourish at work, they need to feel competent. This is the self-determination theory. And then what Professor Hubert and her colleagues have brought to our attention is the contribution that positive psychology makes to this, which is we also need to be noticing what's going well, and to have a sense of meaning in our lives. And with an environment like that, if leaders can build an environment like that, then what we get is flourishing. So the model then gets extended, and I'll invite you to write down numbers 1 to 5 again, and an acronym that helps remind us how that looks in a collective space. We are looking at leaders to create belonging. B. We're going to spell the word bloom. This is the model that they've provided so kindly for us, and we'll send you the references. So people need to feel connected. They need an environment, they need to learn. They need an environment where their personal development is supported so they feel competent. We need to provide opportunity, which means we need to recognise choices that benefit everybody. We need this orientation, what's going on well, and we need a sense of meaning in our lives. So at the collective level, we can discuss these ideas as creating an environment of bloom, belonging, learning, opportunity, orientation, and meaning. So this is what leaders are needing to create to support mental well-being at work, which is where we lead into this fascinating recent discovery of the impact of wisdom in leadership and cultures that create such an environment. The work of Monica Ardelt, her lifetime work has been to help us all measure wisdom. And she has this really well-regarded and widely used measure of wisdom. And those components of wisdom involve our ability to be reflective, compassionate, and have this cognitive process. So there was a group of European consultants that combined the self-determination theory elements and the three-dimensional wisdom elements and discovered this way to describe a wise organization that is developed by wise leadership. Monica Ardelt's study showed a complete correlation between this type of culture, this type of leadership, and employee well-being, which resulted in productivity. So one way, and Julie's just kindly put the paper into the chat. So where this becomes really powerful is if we consider that what leaders are doing is acting in wise ways, which creates the environment that people need to flourish. This compassionate element could be considered like something like soil. The basis of the decisions that leaders are making are on compassionate frameworks. We consider the reflection that's required by leaders is a bit like sunlight. It's guiding. We're using our own reflection to guide our decisions. And we could consider the cognitive process of this wise leadership to be like rain, nourishing and refreshing. It's like a well-tended garden. So the key outcome from this combination of theories, which can be applied to our own lives, is that our goal is to create cultures that provide the psychologically, what's required psychologically for people to flourish. The way we do that is to develop wise leadership and wise organizational cultures, and we know how to do that. Leaders can apply these principles to their own lives in whichever bespoke fashion works. They can develop the capacity for this type of wisdom, which is really involves 3 capacities described by Professor Hubert. We develop an open mind. We can do that with mindfulness practice. We develop an open heart. We can do that with compassion practice. And we can develop clear thinking, which we do by analysing our decisions based on our orientation towards ourselves, others, short-term and long-term. And finally, if we want to apply these in a particular situation, we can follow a model called the Compass model, and Julie's put a paper in the chat that describes that in detail. It's a model that I've written with some colleagues of mine to help us integrate coaching theory and wisdom theory, and essentially suggest that we commit to developing this type of leadership. Our decisions are based on an orientation towards a greater good. We're always trying to take a bigger perspective. We do what we need to do to be mindfully aware of what's going on and to make the small actions that lead to reduce suffering and benefit others. We're sensitive to the impact of our actions and we strategize to make things better. If anything that I've said is of interest to you, there's some things you can do. You could reach out for a conversation to me. I'm happy to talk to any of you. Work on developing those capacities I just listed. You can watch some films, and I'll suggest Life of a King, Evictus, the film about Nelson Mandela, and maybe even Up in the Air, which is a lighthearted film that talks about the recognizing the importance of relationships, leadership and work. There's a white paper on my website, which I will put into the chat, and I will also share the Bloom. So the Bloom acronym comes from the work of Felicia Hubert and colleagues, and it's written up in the Creating the World We Want to Live in book. There's a chapter available which I can share later too. And I'll just put in my website so you can contact me for anything that you would like. Thank you. Any questions?
Thank you. Yeah, everyone, if you could also join me to have a virtual round of applause for your fantastic and really beautiful, a lot of positive moments that you need to reflect on. We are now in our final sessions for our panel discussions. I will be handing over to Dr. Natalie Cutler she's a senior lecturer at the University of Technology, Sydney. She's a leader in mental health nursing and global health education. So her work spans from innovative programs at UTS to mental health initiative in the federal states of Micronesia. Her passion for cross-cultural learning is evident in her international study tours and her research partnership across Australia, Southeast Asia, and Africa. And she's very focused on community-led mental health initiatives and the role of nurses in addressing social determinants of health. It's truly inspiring. Handing over to you, Natalie.
Thank you very much, Connie. So now my job is to bring the panel together to touch on some topics that have been identified preliminarily. The first topic, so we have Elizabeth, we have all of our speakers actually as part of the panel. Elizabeth, we have Connie, I think you're part of the panel, Connie, Bridget and Eleanor, and sorry, my screen is just a little bit tricky to maneuver. I've got multiple screens also, and Dr. Pandit and Associate Professor Fiona Charlson. So if you could all consider yourselves on the panel, if you are able to turn your camera on, that would be really fantastic. Thank you. And so the topics that are listed here for you to reflect on and perhaps say a few words about are the unique aspects of the region, of this region that we're talking about today, that we can learn from. What are some of the inherent protective mechanisms and strengths that exist in the Oceania context to help people stay mentally healthy in the workplace? So it's really looking at what's unique about this region and what are, in its uniqueness, what are some of the strengths, you know, and the protective factors. So we've talked about some of the challenges, and it'd be nice to end our webinar talking about what some of the protective factors and strengths are. There is one or two questions outstanding from the chat, which I might just scroll through while you're having time to reflect and think through those topic areas. So the first question was just for Dr. Pandit, was about, the comment was that it was such a valuable presentation, and wondering what the methodology was that you'd engaged. Was it a quality of life scale, a quantitative data collection, or was it a qualitative approach that you used? And brilliant work is the finishing statement in that question.
Sorry, so is this question related to the study is to me?
Yes, it was. Yeah. So the presentation that you made, and yeah, whether the things that you were reflecting on and presenting were the result of a study, a quantitative study, a survey, or a qualitative
Okay, yeah. Okay.
exploration?
All right. So, so all pointing towards the protective factors, right, and the presentations that I have made. So, starting from the cultural factors first, basically. So, in general, you will see that in Pacific, there is a bit of flexibility in the culture in the culture itself. What I mean by that is people are more accommodative. So even when it is, if I'm talking about, say, deadline, if it is about deadline of a particular task, then you will be, reminded before the deadline. And then at times you do get support as well. Depends on your supervisor, obviously, and the kind of relationship that you have got with the colleagues as well. So generally, in general, there is a supportive environment in the community and culture-wise, if you say. However, when it translates to organization, then we are part of developing world, and the many structured things, the kind of system which is coming is from the Western side. So we are trying to gel here with the system which is coming from Western side, while we culturally we come from Eastern side. So there is a bit of conflicts, salient conflict there. So that needs to be adjusted. That's what my observation has been while working as a manager in this organization. And of course, that requires training as well. And when it comes to training, then the funding and the resources becomes a huge problem. So culturally and at workplace also, if you look at people, they are very accommodative. And there is a support as well. But when it comes to the competence and technological aspects, then as she was, Elizabeth King was highlighting very clearly from the studies, that it's not only, and I had also said that it's both sided, employer as well as employee sided, factors associated with employers and factors associated with employee. So if employee has some issue related to competency of the work, if the employee has issue related to the qualification and training, then obviously that employee will have a bit of a struggle. Then it's responsibility of the employer as well to support a new recruit. And in general, we have very strong policy here in our system. Once you get recruited in any ministry, it's difficult to fire someone. And the reason I'm highlighting it is, as it was also pointed out, that any system that evolves in a particular land is hugely influenced by the culture of that land as well. Because if the same people coming from the same culture who are joining that workforce, be it at managerial level or at a lower level, subordinate level. So in general, the environment is supportive. However, because of lack of resources and logistics, and the more you go in terms of hierarchy, the more you get promoted, the higher you are in position, the more you will realize these challenges related to resources, be it financial, be it human resource or technological resources. And of course, I mean, we do face, especially when it comes to mental health, we have challenges in mental health, not only in Fiji, it's across the globe. If you see, if you look at the history of mental health, I think people have really fought across the globe. They have struggled to bring resources to mental health. And allocation of budget, if you look at allocation of budget also, it's problem everywhere, and more so in developing world, the places which are economically relatively backward or economically not that advanced. These countries face more problem. In terms of studies, there are not enough local studies. However, there are plenty studies on the on the internet. Through internet, we can find through various sources which are available. Some of these studies do point towards the issues in the Pacific, right? And currently, I mean, I'm happy that some studies are going on, and when these studies are, these studies are published, then we will have kind of robust data from our local place, Fiji, as well. However, the material that I got was from the overseas studies mainly, and some of them were obviously from the Pacific centered.
Yeah. Can I just interrupt for a moment? I think that we have one of the panel members that needs to head off, and I just might ask if Bridget is still with us, and if so, would you like to say a few words?
No, Bridget has had to leave. So
Okay, sorry about that. I might just take a pause then, and I'll read to you, to Dr. Pandit and to the panel, another comment that ties in with what you're saying right now, which is, thank you for touching on the importance of the workload. With a lot of skills shortages and migrations happening in Fiji and other organisational needs, the burden falls on existing employees, which greatly affects their mental health, and workers are often left to fend on their own without proper training and end up working due to fear for their jobs. So I think that highlights the sorts of challenges as well that we were talking about earlier. But let's continue with this conversation about what is unique, and I think you did touch on it there, Dr. Pandit, about that cultural conflict, you know, that creates sometimes opportunities as well to do things in a different way. So perhaps I could ask one of the other panel members now to build on what's been said by Dr. Pandit.
So should I go first? So as
maybe I do apologize. I wonder if we could ask someone else just to join in, because we are getting a little bit running out of time. So I might just ask one of the other panel members to add to what's been said so far.
Yes, please, if other panel members can come. Otherwise, I'm happy to contribute. Yeah.
Thank you, Eleanor.
Yes.
It's a slightly slow
Thank
internet.
you, Natalie, as mentioned. And this is commonly about the workload and the reason why people are leaving. What we found from our study was in terms of it's not only those who are on the ground at the operational level, it's even the burnout starts from the top. I think it's the way the health system works, and particularly for Dr. Balram in the psychiatric hospital. When you talk about health equity in terms of the budget that they get 2% of the whole medical budget. So he works on a very limited budget. And because of that, there's a lot of burnout. He's already mentioned that, and it's supported by our study. What we found, that what he talked about in his presentation, that's something that really it stood out. We can resonate with that because that's what the people are saying. They're not looked after. There's no self-care. There's no policy. So people just leave. We've had cases which we didn't highlight in our findings because it didn't clearly come out, although it was mentioned, where doctors have committed suicide because of burnout and because of the workload. And Dr. Balram can attest to that, because that's what's happening in Fiji right now. Yeah, that's just a few things that I would like to add, Natalie.
No, thank you very much, Eleanor. Very, very powerful and important point. I'm conscious that we are just about out of time. Is there anything any of the other panel members would like to say just briefly about what we can all do to improve wellbeing in the workplace that hasn't already been said? And if not, I might hand back to our moderator and for the closing presentation. Thank you, Connie.
Thank you all presenters. Really fabulous and fantastic to have you to share your insights and expertise with us today. final word, I just want to thank all the members of Oceania Mental Health Webinar Working Group. So for this fabulous webinar, so the members are Julie Millard, Natalie Cutler, Elizabeth King, Peter and Francesco, Chitel, Kumar, and myself. So, and also for all of you for your amazing work in this space. Please be in touch and take care and have a wonderful World Mental Health Day. Thank you so much.